Could what you eat make your cancer treatment more effective? Today I'm joined by Dr. Hans Kim, a radiation oncologist with a special interest in ketosis. Dr. Kim is here to shed light on how a ketogenic diet might boost the power of radiation therapy in treating cancer. We'll explore the science behind ketosis and radiation, how our modern diets might be working against us, and look at studies that show promise for breast cancer and brain tumor patients. Stay until the end. Dr. Kim helps us understand why our evolutionary past could be the key to making better dietary choices for cancer prevention and overall health. This perspective might just change the way you think about your next meal. You're listening to the Born to Heal podcast, and I'm your host, Dr. Katie Deming. After 2 decades of practicing as an oncologist and caring for thousands of patients, I've seen firsthand how our healthcare system places obstacles in your path to true healing. My guests and I will bridge the worlds of Western medicine and alternative healing to help you achieve optimal health. Expect to uncover new insights, share a few laughs, and maybe even shed some tears along the way. But most of all, we'll learn how to heal from within together. So let's dive into today's episode. Today, I am joined by Dr. Hans Kim, who is a radiation oncologist with a special interest in ketosis. And so I'm excited to talk about all things radiation and ketosis with you today, Dr. Kim. Welcome.
Katie, thank you so much. And when I first got to know you 2 years ago, I was so excited that you were actually you are a radiation oncologist. And I'm hoping from this session that, our audience understand that ketosis is so relevant to, particularly for radiation treatment. So I'm happy to talk about the data and, some encouraging study that's going on.
Well, let's just dive in and talk about why is ketosis important with radiation? Why are we even having this conversation? Do you want to kind of give us a little background?
Absolutely. A lot of the basic study actually comes from the University of Iowa, Douglas Spitz group, and I'll leave the references for the audience for them to read. So Douglas Spitz is a free radical scientist at the University of Iowa, and he's affiliated with the radiation oncology department at the University of Iowa. Dr. John Boadi is the chair. They've done early trials in cell and in animal, and they found out when your metabolism maintained ketosis by giving ketogenic diet, the tumors actually were extremely radiosensitized from the radiation treatments. That was their early observation from the both in vivo and in vitro trial, and they've done some pretty remarkable in an animal study that when these mice were put on ketogenic diet, the radiation treatments was much more effective. When they further investigated what is really the behind mechanism, it boils down to oxidative stress. Now, Katie, you and I, we know we have to take our radiation biology board. We do learn a little bit about the oxidative stress, remember the 4 R's, right? One of the 4 R's is reoxygenation. So oxygenation plays a huge role when it comes to radiation treatments, right? And more oxygen you have in your body, we know that our radiation treatment is more effective. I think I'm kind of really relatively new in training, but I heard from my older attendings, they used to do blood transfusion before they do radiation if their hemoglobin is really low. I don't know if you had to do that, Katie, before, but... No,
I'm not. I guess I'm not that old, but...
I'm sorry, I didn't mean that way, but yeah, so for our audiences, we let, oxygen plays a huge role for the radiation to work, because what radiation does in our body is that majority of our body is water, right? So once radiation hits our body, it's going to cause free radical oxygen species, and those oxygen species break the cancer's DNA. And what we found out from Dr. Spitz's work from the University of Iowa is that these cancer cells are much more vulnerable to these oxidative stress generated by radiation, especially when the cells are under ketosis.
So, and just so that everyone is tracking with us, what Dr. Kim is describing here is that the mechanism that radiation uses to damage the DNA of the cancer cells is through free radical damage. So basically, the radiation is breaking apart the water and creating free radicals from the oxygen species in the water. And those oxygen radicals then damage the DNA, leading to cell death of the cancer cells. Is that correct, Dr. Kim?
That is correct. And that's one of many mechanisms, including the mechanisms we're not aware of.
So what I'd like to do is I'd like to have you explain with ketosis, what exactly is happening there so that we can understand the science behind it before we go into some of the studies and explaining how this has been shown.
Absolutely. So in order to do that, I think that one of the best literature out there is published by another radiation oncologist, Brian Allen, and he's a radiation oncologist from the University of Iowa. And I'd like to pull up his papers, and our audiences can go. I think this is all publicly available, full text from PubMed. So in this paper, it does a really good job really describing the different metabolism between cancers and normal cells. So this is a great paper for all the audiences, both medical providers and our patients listening to Katie's podcast. I really strongly recommend reading this paper. It was published a few years ago by Dr. Brian Allen. He's another board-certified radiation oncologist at the University of Iowa. He's done great research. As you can see from the article, ketogenic diets as an adjuvant cancer therapy, history and potential mechanism. And one of the really helpful figures, it basically shows what is really the behind mechanism of ketogenic diet / ketosis. Tumor cells versus, healthy cells. So what you're looking at is from this diagram that under normal diet, what you're seeing in tumor cells is that they have elevated glycolytic pathway metabolism. What that means is, the famous Warburg effect, right? They do more fermentation, they do more glycolysis, converting glucose to lactate, which is one of the abnormal metabolism, Otto Warburg discovered and coined as a Warburg effect. And this is probably one of the reasons we're still using PET scan as one of the main modality, because obviously you're injecting glucose analog in PET scan, and wherever the glucose uptakes are, they're where the cancers are. So we've known that tumor cells take a lot of glucose. This is what you're seeing in tumor cells with a normal diet, right? You're having such a high upregulation, consuming glucose, not only through this analog, anaerobic glycolytic pathway, but also what we call the pentose phosphate shunt way, which manufactures as NADPH. So you can see this diagram basically showing upregulation of this metabolism that utilizes glucose more than compared to normal cells on the left. Now, when we apply ketosis, so when you accomplish ketosis through the ketogenic diet, right, which is also termed as nutritional ketosis, right? So again, just a heads up, this is not a DKA, diabetes ketoacidosis, where, patients are going to die. This is a natural metabolism state our bodies accomplish when you have a low carb and when your body start using fat as an energy source. So if you look at this diagram below here, you can actually see what ketogenic diet leading to nutritional ketosis can do to really go against what tumor metabolism is shown on this big picture. This is a little bit complicated, Katie, so I'm going to pause there. I'll let you, speak and ask me any questions for the audience.
Sure. Well, and also for the audience, we will link this study in the show notes so that you can find it. And there is this nice diagram that you can see that's quite complex. But for a review for our listeners who've listened to other episodes where I've talked about the Warburg effect, just to summarize this again, is that Otto Warburg described that cancer cells are taking up a lot of sugar, more sugar than you would expect, and creating a lot more lactic acid in the presence of oxygen, which you would not expect for normal healthy cells. And this is one of the hallmarks of cancer, is having the production of lactic acid and this really increased use of sugar. Okay. And so the idea behind this is that cancer cells are using a different type of metabolism than our healthy normal cells that are using oxidative phosphorylation for metabolism. Cancer cells are using fermentation. And if they're using this specific pathway of metabolism, we can target that or reduce glucose as a fuel source, since the only fuel that can be used for fermentation is glucose. And so this is why ketogenic diet has become a potential therapeutic option for cancer, is because of this use of fermentation by cancer cells for their metabolic pathways and the preferential use of glucose. So I'll just give that as a little summary just to make sure everyone's following with where we're at right now. So Hans, I'll let you take it from there.
Yes, absolutely. Perfect summary, Katie. So, but what is so special with radiation? I think this is the part where I think as we, both of us as radiation oncologists, I really think this is so relevant to especially with radiation therapy, is I want to have you focus on this NADPH production through this pentose phosphate shuntway. So as you were describing the Warburg effect, there are two main pathways that glucose are upregulated in tumor cells. One is that what you were describing, the fermentation pathway where glucose get converted to lactate. The other pathway is through the pentose phosphate pathway. It's called, in short, PPP, triple Ps. At the end of the product is ribulose 5-phosphate, which is the building block of DNA and RNA. It is also a building through the pentose triple P pathway. The tumor cells are able to convert NADP to NADPH. And this is why radiation is so relevant. Again, Katie, going back to basic principle of radiation biology, remember, whenever cells are having oxidative stress, right, what is the main reducing agent in our body? It's actually NADPH. It's not NADH, but it is NADPH with a phosphate. NADPH plays such an integral role fighting the oxidative stress. So the more NADPH you have in your body, tumor cells are able to counter the oxidative stress from, inherent oxidative stress that tumor cells have. So I don't want to go into too much of detail, but based on, Dr. Spitz's group, the hypothesis that because tumor cells are proliferating so quickly, they have a faulty electron transport system in their cell membrane, mitochondria. They have a leakage of the oxidative, stress through their membrane. So it is hypothesized that tumor cells have inherently more higher oxidative stress. Therefore, through the evolutionary of cancer metabolism, cancer biology, the tumor cells are evolved to have more NADPH production, which can fight against oxidative stress that they have. But guess what radiation does, right? It doesn't help tumor cells, right? By giving radiations, we will cause more oxidative stress. So therefore, tumor cells are actually depleting their NADPH even more faster. So that's where the key concepts of radiation kicks in that is relevant to the nutritional ketosis that can be accomplished by ketogenic diet.
Hey, it's Dr. Katie. You may have noticed that I talk a lot about water on this podcast. After a year of research, I've learned that optimal water needs 3 key elements: filtration, mineralization, and structure, just like natural spring water. Doing all these steps to my own drinking water took me several hours a week. That's why I'm so impressed with Spring Aqua. Their system incorporates all 3 elements in one system that is basically modeling its technology after the renowned healing waters of the spring at Lourdes, France. I personally use their Wet 7 model, which offers alkalinized hydrogen water and saves me hours each week. Spring Aqua has dramatically improved hydration for both me and my family, and I believe it could do the same for you. I recently had the owner, Kenny Liu, on the show, and his integrity really shines through in this product. If you're interested in experiencing truly hydrating water that mimics nature's process, please visit the link in the episode description. So with this understanding of, NADPH basically being taken up with the radiation damage causing oxidative stress, using up this NADPH, tell us how ketogenic diet now plays into all of this.
Precisely. Not only that, it's much more than oxidative stress. Think about it. If you're on ketogenic diet leading to ketosis, effective ketosis, right? You're depleting that glucose, right? You're preventing cancers to even having that uptake of glucose, preventing those glucose to be converted to ribulose 5-phosphate through the pentose shuntway, preventing them to make more NADPH, right? So that is really the essence of the mechanism behind ketogenic diet. Now, guess what? NADPH has multiple roles in our body. It's not only fighting against the oxidative stress, but guess what it's needed for? It is needed for fatty acid synthesis. Think about it, right? And it makes perfect sense. This is a tumor metabolism machinery that has evolved to proliferate endlessly, right? So it makes sense they're using glucose to make the building block of ribulose, building block of the RNA and DNA. But not only that, they're making NADPH, which is needed for fatty acid synthesis. So going back to step one, how is fatty acid being synthesized? It's from glucose, right? So you got two glucose molecules together and you're adding two carbons at the same time. And then whenever you add that 2 carbons to 4 carbons molecule, you need 1 molecule of NADPH. It's not the NADH, but it is the NADPH that is needed for fatty acid synthesis. And there are multiple literatures out there that when you see tumor proliferation, you get huge upregulation of this pentose phosphate shunt way because they need more NADPH, not only to fight against oxidative stress, but they're using it as to build fatty acids. And guess what we need? Guess what needs fatty acid? It's tumor cells, because the plasma membrane that needs the basic cell structures for tumor cells, it's fatty acids.
Awesome. Okay. So basically, to help people follow with that, is that the NADPH as, a product of this pathway is you need the NADPH for upregulation for basically production of the fatty acids, and the cancer cells need the fatty acids for their survival. So this is part of what they are doing, is creating fatty acids so that they continue to grow and proliferate and have healthy cell membrane.
That is precisely correct.
Okay, awesome. So tell us, what is the next piece that they need to know about this and how it ties in with radiation?
Absolutely. So I do want to have our audience just to read another great paper published by another radiation oncologist. I mean, I'm amazed that how many radiation oncologists out there really is into more kind of holistic approach and more. It's really fascinating. So the paper is published by Colin Shamp. I don't know, Katie, you heard Dr. Shamp before. He was attending at UPMC in Pittsburgh, and then he moved to Duke, and where he published this paper called Keto. So I don't know if you're able to see this here, Katie, that, picture of Colin Shamp here. And this was a study that he published. Again, I'll send you the full context, but it was called the KetoComp trial. He basically, for those breast cancer patients undergoing radiation treatments, half of the group, they were on normal diet, and versus the other half were on ketogenic diet. The endpoint of this trial wasn't overall survival or progression-free disease. It's going to take hundreds of years to do that, to prove that in early stage breast cancer, as we all know. I mean, it's going to be very hard to find any kind of changes. But, long story short, Dr. Shamp wanted to just prove that ketogenic diet, along with breast radiation treatment, is a very safe and doable treatments. A lot of the criticism when you're, as a radiation oncologist, you recommend kind of ketogenic diet. I hear a lot of the criticism from your medical oncologist or other oncologists saying, your patients are losing weight. We're really worried about it, and we're so obsessed about the weight. But you're going to get some weight loss, but it's very important that you understand the weight loss you get from healthy ketogenic diet or nutritional ketosis is mainly the fat mass, which is kind of water-based mass, right? The lean body mass actually is very stable, and this is exactly what he tried to prove in this paper. So long story short, this is a really good paper for especially breast cancer patients out there who want to test ketogenic diet as part of the treatments. But full disclaimer, there's no known benefit in terms of when it comes to oncology outcome. This was not designed for that.
Yeah. So this particular study was not designed to look at a benefit. What it was really doing was to establish safety, that this is a safe mechanism or safe therapeutic intervention that can be done during radiation. And one of the big things that I can think of as a radiation oncologist who might be listening to this and thinking, well, weight loss is a problem with breast radiation because we don't want change in the contour of the body because it can change, the depth dose and all of the, things that we measure at the beginning of radiation in the planning session, which is called the simulation. People worry that if you have significant weight loss, that's going to be a problem. So is that one of the things that they looked in here, that the weight loss from a radiation standpoint wasn't a problem?
Absolutely. And as a matter of fact, him being a radiation oncologist, that's exactly what he was tracking. And, as you can see from this screen here, I think I captured the conclusions. Basically, what Dr. Colleen Shamp is saying is, in summary, ketogenic diet in breast cancer population during radiotherapy improved body composition compared to a standard diet, just a regular diet, with reduction in body weight that were mostly due to the fat mass loss and a rapid water loss soon after the diet onset. So basically, he was concluding that ketogenic diet, and also he mentioned that actually ketogenic diet induced some favorable hormone changes, right? As you lose weight, right, your body is going to create less estrogen. We know fat tissues create estrogen, and a lot of our patients are put on letrozole or some kind of anti-estrogen therapy. So they were able to see those favorable hormone changes as they were using mainly a fat mass. And basically, this was tested in a community hospital setting, like where I'm practicing in Klamath Falls. And so he basically showed that this is, very doable, feasible, and as a matter of fact, could potentially give you, some favorable outcomes, as the conclusion is written down here in this paper.
Perfect. I love it. And we will also link this conclusion to the study in the show notes.
Sounds good.
So we have this study that shows us that it's safe in radiation. And then, so tell us what, the benefit, are there any studies that show a benefit to using ketosis during radiation in terms of therapeutic benefit, not only safety?
Absolutely. Absolutely. So, it's going to be really hard to prove that in breast cancer setting, I guess, because it's just in general, slow growing cancer. Prostate cancer, slow growing cancer compared to other aggressive cancers. One of the biggest attraction of a lot of ketogenic experts were actually glioblastoma. And I'm really excited to tell you, my colleague and my friend, Jethro Hu, is, he's a neuro-med-onc at Cedars-Sinai in LA. And I met him during the conference a couple of years ago, and he presented his phase 1 data that he was able to enroll about 14 patients who had glioblastoma. But it's really interesting to see how this study became to reality. Was actually his patients who had a very good, I guess we're talking about LA Cedars-Sinai that treats a lot of, VIP Hollywood stars, so you can imagine these are kind of not the representative of the, in general, average American population, but they have the means, they have more means to accomplish this difficult diet, ketogenic diet. As many of our audience know, ketogenic diet is not an easy diet, right? So, but Jethro was explaining how he was able to do the study, and it was really driven by patients. He had all these patients who were diagnosed with glioblastoma, like dozen of them, saying that we want to do this, Dr. Hu. What can we do to help? So Jethro had an amazing partner, oncologic nutritionist. Her name is LJ, and she has a great training background from Memorial Sloan Kettering. And, I've been in touch with LJ, both LJ and Jethro. So with the help of LJ, the dietitian, a dedicated oncologic dietitian, they were able to accomplish the ketogenic diet very safely to a dozen of patients. And this is the data you're seeing. Imagine you're seeing this data in glioblastoma by big pharma company. You're sitting on $1 billion. Unfortunately, there isn't a lot of, monetary driving factors when it comes to, treating cancer using diet. But if you can see even though this is phase 1, take a look at that results.
Well, and can you explain for the audience what phase 1, the intention of a phase 1 study is, just so that they understand the difference?
Absolutely. So phase 1 trial is really the first step of accomplishing a better quality of trial. Gold standard trial will be phase 3 randomized trial, which is a larger scale of trials. Phase 1 is usually testing feasibility and safety. So the goal of this phase 1 trial was to just show that ketogenic diet for glioblastoma patient on top of the standard care, which is surgery followed by radiation and then temozolomide, which is the chemo, was safe and doable. And they not only showed that, but they also showed that if you look at this published data, and I think this was published in ASCO, and if you look at the median overall survival from the historical EORTC trial, which is only 14.6 months, they were able to accomplish almost close to 30 months. So double the median overall survival.
Which is crazy in this population to move the needle that much from a little over a year median survival to 2.5 years is really incredible. And like Hans said, if this was a drug, we would be like screaming from the rooftops, like this is the answer, this is the cure for glioblastoma. But because it's diet, we're not really even probably talking about it. This is from 2022, this data, but it's amazing that we're doing these studies. And I love that Dr. Hu is doing this. This is incredible.
Absolutely. And I'm more even excited to tell that they moved on to the next phase. So they're doing phase 2 trial. And I believe it might be randomized or not, but they're designing the trial. And let me see if I can share that screen.
And while you're pulling that up, I'm actually just going to explain something that, people have asked me, why is it that the only data for a ketogenic diet is in glioblastoma, these very aggressive brain tumors? And what Hans said earlier is really important, is that when you're looking for benefits of an intervention, like if we were going to study a new drug in cancer, we say that it was a particular type of cancer, let's just say it's breast cancer, you're going to pick the population that has the worst outcomes with whatever is considered standard of care currently to study, because you want to see the biggest benefit. So you're not going to take the people who are already doing really well and like have a 95% chance of a 5-year survival with no recurrence for your study group, because it's hard to show that benefit. And that's what Hans was saying about in the breast cancer group, is you'd have to study a lot of women for decades to see any kind of benefit. And so with a group like GBM, this is a group of patients that has a poor prognosis to start with. And so when you intervene with something, if it works, you're more likely to see a benefit. And this is why the studies have been done with GBM, is because this is a population where you can actually really move the needle. But it's not to say that there's not a benefit in these other areas. It's just that we're already doing well in a lot of these areas. And so that benefit is going to take longer and more patients to see that benefit.
Absolutely, Katie. Well said. And that's exactly what, our patients, need to understand. Does it mean it's not effective? No, I wouldn't say so. As a matter of fact, I just want to share my own story recently where I recommended adjuvant radiation versus emission. As we all know, Katie, radiation, we're doing less. Less is better. We're trying to emit radiation for this population who has early stage favorable outcome. So she was kind of at that kind of borderline. And as you know, I'm
This is someone with breast cancer?
Correct.
Okay.
Correct. And I actually printed out, the Colleen Sham's paper, and she read through. And she said, and as soon as she got the paper, she started on a low carb, not a really, rigorous ketogenic diet, but low carb diet. And 1 month later, she came back as my follow up, and she said, Dr. Kim, I can't thank you enough. This really changed me. I feel much better. I just lost like 20 pounds, just changing my diet. I feel great. And I don't think I want to get radiation.
Yeah. Well, and for her, you were offering omission versus treatment. So it was optional to do the treatment. Is that right? And so what I love about that is she's not receiving the treatment and she's receiving additional benefit by changing her diet. So I love that. Well done.
Correct. So yeah, that's something I'm actually still able to do here in Klamath Falls and for our community patients here. And, I'm trying to, integrate those. But like I said, just because we don't have any confirmed phase 3 trial, which is going to be, as just what Katie was explaining, hard to do in breast cancer, it doesn't mean it's not going to work.
So tell us what is this next study? And again, like I said, we're going to link all of these studies so that you guys can see them.
Absolutely. Not really sure if you're able to see this trial link here, but this is, again, for the audience out there, clinicaltrials.gov is really the go-to website when you want to take a look at what are the real trials being funded by NIH. And you can actually see that here, sponsored by Dr. Jethro Hu from Cedars-Sinai Medical Center, ketogenic diet in combination with standard of care radiation and temozolomide for patients with glioblastoma. So finally, Jethro was able to get the funding to support this trial. It's still active. It says not recruiting, so I really don't know what's going on, what the status is, but, I can, ask Dr. Hu what's going on, but it's still active. So for those who are interested in, feel free to, check the design of the study. But this is really the first major NIH-funded trial that is going to compare the ketogenic diet versus standard diet on top of the standard care for glioblastoma. So, I think this study will give us a lot more information. It's built upon that phase 1 trial that I just showed.
Okay, so this is basically just taking the initial trial and then duplicating it now with patients who are being randomized or not randomized. So this is just this is phase 2, so they're not. It's just following people who have ketogenic diet. Is that correct?
I think that's the design.
Okay.
Yes.
So this particular trial is open. And what Hans was saying about this is that the clinicaltrials.gov is a website that you can go to find open clinical trials that may be relevant for your particular condition. So this is a place that you can go and you can look for studies that are open. And this one right now is open for people with GBM, although it's unclear. It says not, like you said, not registering or not enrolling. What does it say?
Active, not recruiting.
Yeah. But anyway, so this trial is underway. And how long has this been accruing?
I believe he started this in either 2003. It's been at least a couple of years. 2023.
Okay, I was like, wow, that's a long time ago.
Yeah, no, just a couple of years.
Okay, perfect. Mm-hmm. But this is an example. And I think this is important for people to know is that these are the only trials that are happening right now with radiation and ketosis. But what we've seen here so far is that there's study in breast cancer showing that it's safe, that you can do this, and that there is a change of body composition, but that it's for the better, reducing fat, and doesn't interfere with the delivery of the radiation, given, shifts in the way the body is shaped and, the questions that radiation oncologists have about weight loss during breast radiotherapy. So we have that study. And then we have the study with glioblastoma showing that not only is it safe, but it's effective and it's doubling survival time. So Hans, what I want to ask you is, what does this look like for therapeutic or medical ketosis during radiation? How are you doing this in your clinic? Is it always done with a nutritionist? Just so that people understand if they want to execute this kind of strategy, what is involved?
Absolutely. Those are all great questions. And I want to also make sure that our audience understands. So Jethro, who is not a radiation oncologist, his hypothesis is not really involving radiation per se, but I think it's still safe to say that, it's going to, with the oxidative stress theory behind, it'll still kind of prove, what the hypothesis is, why ketogenic diet will work better with radiation. But I would just want to make it clear for the audience out there, Dr. Hu is not a radiation oncologist. I did give this presentation to Dr. Hu's team just a year ago, but, this wasn't part of the hypothesis. So I just want to make it clear with that. Now, I don't know if I told you before, Katie, but I decided to go into radiation oncologist after I saw the University of Iowa data on ketogenic diet. I asked myself, I want to be a cancer doctor, but I strongly believe in patient empowerment. What specialty, what kind of cancer doctor am I going to be? And I asked myself, what is the specialist that can potentially give the most patient empowerment? It wasn't going to be the surgeon, right? We don't want patient to move around during the surgery. It wasn't going to be medical oncologists. I mean, we have so many drugs right now, immunotherapy, chemo. It's almost like, I feel like as a cancer doctor, I feel like I'm not even empowered anymore. It was radiation, right? Because I imagined myself as being a radiation oncologist and working with my patients while they get radiation. Hey, maybe this diet can help the outcome. This is something you can do while you're getting my radiation treatments. So that was the reason I chose radiation oncologist. And I've worked really hard to get funding through my residency training. Unfortunately, the reality is I just got to pass my board. I got to survive. I got a family to feed. So how do I really incorporate this in my practice? I do. For example, like the breast cancer patient I talked about, I provide this paper. I provide the KetoComp trials. I provide the University of Iowa's paper. If they ask me the questions about diet, hey doctor, is there anything I can do? I provide more information, right? So I haven't seen any glioblastoma patients so far in Klamath Falls. The other thing I wanted to add for Dr. Who's trial is actually they do telemedicine too. The first visit, you have to be in person. So it doesn't matter where you get surgery or radiation, they'll do the telemedicine. But I haven't seen any glioblastoma since I came here at Klamath Falls or Sky Lakes. But yeah, I do try to bring those into my practice, everyday practice.
And so thank you for clarifying that about Dr. Who, am I pronouncing his name? Is it
Dr. Who's?
Who?
Yeah, H-U.
Who?
So
Yeah.
Jeffrey Who.
Dr. Who's background. So he's a medical oncologist who specializes in glioblastoma, but the protocol for someone with glioblastoma is surgery followed by radiation and chemotherapy. So it's basically encompassing this whole platform. But thank you for clarifying that he's not a radiation oncologist and that trial is not specifically just about radiation. And also this is why I love Hans. The first time I met him, I'm like, I love him because you have such a holistic approach to your practice. And also that you were thinking about this like when you were a resident, because you and I connected when you were still a resident and you were so passionate about teaching people about ketosis. And you're absolutely right. I think that radiation is a great specialty where we're not making people so sick too, that you can actually do some of this and the weight loss is less of an issue. Whereas if you're dealing with someone who's losing a ton of weight related to their chemo or whatever, it can be difficult to incorporate a strategy like this. But so let me ask you, what does that look like? So if patients are interested, you're giving them the data, you're explaining that there's a potential benefit of this, but then say someone's interested, where are you directing them to actually get themselves into medical ketosis?
Excellent questions. And when I was at OHSA as a resident, I did pair up with some dietitian, nutritionists to actually launch the trial. So I have a little bit of insights. I haven't been able to do that in a research setting, but the first step would be understanding what ketosis means, right? And understanding how safely you can accomplish that by cutting your carb. It's a hard diet. And unfortunately, at my own clinic here at Sky Lakes, I don't have any trained nutritionist or dietitian that can, teach that stuff, but everything's online, right? So you can look it up. The first thing is that you want to buy some kind of device that measures your blood glucose. And one of the products I really like is called Keto Mojo. And Keto Mojo is from the United Kingdom. And I think LJ uses Keto Mojo. This is the oncologic nutritionist, dietitianist from Cedars-Sinai working with Dr. Jethro Who. She uses Keto Mojo and it can measure your blood glucose. And also you can measure your ketone bodies to tell you if you're accomplishing nutritional ketosis. But again, it is true that we lack the resources to really guide the patients who are really interested in it. That being said, for my future patients here in Klamath Falls or in our community, I do have resources to kind of introduce them to the dietitian nutritionist in our country. So, but personally, it's been challenging.
Well, and I ask this too, because this is the challenge that I experience also, that finding dietitians or nutritionists who are really trained in this is actually challenging because there are not very many that are trained well. And so just for the listeners, the Keto Mojo is what I use. So this is what I use in my practice as well. We do the GKI monitoring with the ketones daily in the morning and as well as blood glucose, doing it both an hour after waking, before eating or exercising, as a way to track your blood glucose and also your blood ketones. And we will do, I think I need to do another episode where maybe I can bring LJ. Is that her name, the dietitian?
Yes.
So
yes.
I think it would be great that I could bring her on, and maybe that would be our conversation about how to actually do this. But I wanted to bring you on to talk about this specifically with radiation, because this is a question that I get a lot. So I specialized in breast cancer when I was practicing radiation oncology. And then now I see, all different types of cancer, but I see a lot of women with breast cancer. And literally just this morning, one of my clients said, I'm going to start radiation next week, and I'm wondering what I can do from a dietary standpoint. So this is something that we should be talking about. And then I think the other thing is, just knowing if you're thinking about doing ketosis during radiation, knowing about this data and having this data you can bring to your radiation oncologist to say, yes, this is safe. That's been studied at Duke University for women with breast cancer, and that this is feasible and it can be done. And my guess is the biggest pushback that you would get would be around weight loss. But just knowing as a radiation oncologist, that would probably be my only concern, is that we'll just have to be monitoring your separation, just basically the shape of the breast and everything. But the truth is that when the amount of weight that's lost and also over radiation is now relatively short, right? Instead of it being, always 6 or 7 weeks of daily treatment like it used to be when I was first practicing, now most of the time it's 3 or 4 weeks, and the amount of weight loss and the change that's going to happen is probably not that significant. So, and your doctor and your radiation team is measuring your body while you're going through treatment to see if any changes would impact the treatment, and then they would just replan it. But obviously that's what they don't want to do, is to have to replan everything in the middle. But I think that is unlikely. But just knowing, I think, what the objections might be would be helpful before you go and speak with your doctor. I'm wondering, Hans, if there's anything else that you would like to say. And I do want to bring you back. I know you have some interesting things you want to talk about with ascorbic acid as well, which we'll do on another episode. But I'm wondering if there's anything else that you want to say for people who are curious about radiation and ketosis.
Yeah, I guess it's safe to say we do have some degree of evidence, not a really good data to be impactful to the point that it's going to be practice changing. But if I have glioblastoma, I'll certainly try ketogenic as much as possible, because I understanding the mechanism behind it makes sense. Also, I really think a low carb diet is in general more healthier diet that's compatible with us. And, I don't think it's rocket science I don't have any PhD in diets or nutrition, but when my patients ask me what's the healthiest, what are the healthy diet, in general, outside of radiation or cancer, I always tell them, hey, the key is in our body. So what that means is we're the product of long evolutionary process, right? So whatever our body has been evolved for or evolved from, or with the context of our environments, that's what our body can handle the most, or at best. Think about it, right? It's abnormal to have this much of processed food and high carbs diet. It's not even about, whether the foods are processed or not. Our body is more designed to the handle of, the pre-civilization, like probably hunters gatherers, where a lot of us were starving and we weren't eating a lot, and we certainly didn't have lots of carbs. It was probably lots of fat, plants. So our bodies have evolved to survive that kind of environment, and we haven't been able to evolve from the short, century or half century of civilization or processed, food that we're so used to it now. And if you look at all the enzymes in the hormones in our body, guess how many hormones out there that is counteracting abundant of carbs or abundant of sugars? There's only one, which is insulin. The rest of the hormones are all fight or flight stress hormones, right? Norepinephrine, cortisol, because we were evolved to survive starvation and not eating food. That's how we were evolved. Our body was much more interested in utilizing fat as an energy source.
Yeah. Well, and I think that this ties back into the statistics that we're seeing is, this rise of diabetes, obesity, neurodegenerative disease, cancer are all rising exponentially. And it's related to the way that we're living, the way that we're eating, the way that we're not moving. And I think this is, the diet thing was really confusing when I first stepped outside of Western medicine, because I was really open. I was like, I just want to know what is the data about all of these different types of diets. And I really have landed in the low carbohydrate, higher fat diet. I think that this, if you look back at the way we were evolved, that we were hunter-gatherers, like you said, there was not a lot of food around. And that when we had, basically a hunt, we would eat that meat and that would sustain us. And then there would be periods where we wouldn't eat at all. And that's where ketosis comes in, that we can use. And actually that is the preferred, fuel for our body is ketone bodies. And that's because we would have these periods where we would have food and then we would have no food. And we now live in an environment where food is just everywhere. And it's a problem, actually, that we have so much available because we're designed to eat as much as we can to survive, right? But now that strategy is harming us. And so I think, for me, what I always look back to is, okay, what was it that we were doing before modern industrialized society? And when I look at these diets where people are eating so much fruit and vegetables, like just tons and tons, I'm like, we never had access to that much. And also seasonality, that we only ate like berries for like a couple weeks a year, right? Of like strawberries, we'd have a couple weeks, raspberry, we'd have a couple weeks. We would not have access to these things all year long. And so when we go into the supermarket, we are seeing an unnatural source of food. Right. And so actually, I love this. I heard from Candy Fraser from Primal Bod. She talks about hunting. She's like, we are still hunters, but the problem is now you have to hunt in the supermarket and now you have to hunt at your farmer's market. And so now when I go out, I look at the food so differently. And actually what's crazy is I moved into a house just 2 months ago that's a block away from Safeway. And I found that I buy very little. I'm like, there are very few things that I will buy from this store that actually I would consider food. And that's just, me hunting now. Like I see that we're still hunters, but now the problem is different. Instead of being scarcity and not having enough food, you have too much food and you have a lot of food that was produced in ways that is not good for your body. So not only the processed food, but the way that our meat, we want to eat food that was raised in the best manner for that animal, plant, whatever it is. So you want to eat food that was treated in the best way for that organism. Then that becomes healthy for you. So biodynamic farming, making sure that your, meat is grass-fed, grass-finished if you can afford it, and, pasture-raised for your eggs, getting things at the farmer's market when you can. And, little things like the gas station down the street from me happens to be owned by someone who has a farm. And so they have amazing eggs. So I just get my eggs at the gas station. It's just things like this. But I love that you brought that up, Hans, because this is something that actually is a big problem in the cancer space. There is a lot of misdirect about this idea that you have to eat like 3,000 plants a day and like all these things. But I don't think that that's actually how we were designed.
Absolutely. Well said, Katie. That's exactly, I think you well said exactly what I was trying to convey. And I agree with, eating the stuff that we were used to, right? Not, in animals where it's packed full of, animals, they're giving whole bunch of antibiotics and all that. And that's one of the reasons I came to, Klamath Falls, because, we were planning on buying some more lands and raising chickens, and, it's going to be organic by default. So yeah, I truly believe that's probably a healthier lifestyle. I do want to end with one more kind of slide, which I think, you and other audience, including the medical provider, will appreciate, since we're talking about the diet and does it matter where the calorie comes from. So I'm going to send you this link to Katie for our audience, but it's basically from Craig Thompson, who is a medical oncologist, and he's also CEO at Sloan Kettering, which is a top-notch cancer center. And he actually has a really nice YouTube video clip that people can watch. And he asked the audience, overeating which types of foods increases the risk of cancer? A, fats, B, carbohydrates, C, proteins. And I'm going to leave the answer to the audience and to you. And his conclusion is it matters where the calories come from to reduce the risk of cancer. So, we have this, this CEO from Sloan Kettering, a top-notch cancer center, saying that it matters where the calorie comes from if you want to reduce the cancer risk. I mean, I think, I don't think you have to look even further how diet is important in general for cancer.
Absolutely. I love it. Well, Hans, thank you so much for joining us today. And I look forward to talking about ascorbic acid in the, coming weeks to months.
Thank you so much, Katie.
It was a pleasure.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you, and I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal. What if healing cancer didn't have to be so overwhelming and confusing? What if you could access a higher level of consciousness to accelerate healing? And what if you had a clear roadmap to follow, a path to lead you out of the fear and uncertainty? Hi, I'm Dr. Katie Deming. As an oncologist who's cared for thousands of patients, let me guide you safely through the fog. My 6 Pillars of Healing Cancer workshop series is now available, and it's not too late to join. Choose from a range of powerful workshops, each designed to support your healing journey, covering nutrition, emotional well-being, hydration, physical practices, the mind-body connection, and spirituality. Select only the workshops that align with you, or for a limited time, buy the entire bundle and enjoy significant savings. Don't miss this proven holistic roadmap to clarity and deep inner calm to support your healing process. Check the link in this episode's description to learn more and sign up today. Remember, you've got this.